thousands of lives are being saved every single day by machines. Artificial intelligences that analyze scans, cross medical data, and detect diseases even before symptoms appear. But with this revolution comes a dilemma. When an AI outperforms a doctor, who makes the final decision? In this episode of Curiousverse, we explore what AI is doing in medicine right now and what it could mean for your next diagnosis. Welcome to Curiousverse. When we talk about artificial intelligence in medicine, we're not talking about futuristic robots performing surgeries alone. We're talking about smart software, computer programs that learn to recognize patterns, make predictions, and help doctors make better decisions. Here's how it works. The system is fed with thousands, sometimes millions of scans, diagnostics, medical records, and patient histories. Then it starts identifying connections that are not always obvious to the human eye. But don't worry, it doesn't do this alone. These systems are trained by teams of doctors and scientists to make sure they follow real clinical practices. In short, artificial intelligence in medicine is a tool, an ally that helps organize data, reduce errors, and bring more accuracy and speed to medical decisions. But knowing the concept is one thing, seeing what this technology is actually doing, in real hospitals, real clinics, real lives, is something else. And that's what we'll explore next. If all of this sounds revolutionary in theory, wait until you see what's already happening in real life. In many hospitals across the United States, AI systems can already analyze chest X-rays and flag suspicious cases of pneumonia or fractures in just seconds. In ophthalmology, for example, a system called IDXDR, approved by the FDA, analyzes retinal images to detect signs of diabetic retinopathy without needing a specialist on site. Like in the case of Lisa, a 58-year-old schoolteacher from Texas. She walked into a rural clinic for a simple checkup. The AI flagged an early sign of retinopathy, something she hadn't noticed yet. Because of that, she began treatment, in time, to save her vision. In cardiology, researchers at the Mayo Clinic developed an AI that can detect hidden ventricular dysfunction in ECGs that look completely normal, something even experienced doctors might miss. In oncology, AI analyzes biopsies and identifies cancer cells with accuracy comparable to the best pathologists. And the most groundbreaking part? AI is now being used to predict diseases before they even start. It combines your medical history, test results, and population data to calculate your risk of stroke, diabetes, or Alzheimer's, years before the first symptoms appear. But if AI is this powerful, why isn't it already saving lives in every hospital? The answer reveals a darker and inevitable side of this revolution. So far, everything sounds promising. Faster, more accurate diagnoses, and even disease prevention. But like any powerful technology, artificial intelligence in medicine comes with risks, and that's exactly why it's not in every hospital yet. One of the biggest issues lies at its core: the data. AI is only as good as the data it receives. If that data is incomplete, biased, or poorly distributed, the system learns incorrectly, and the data can lead to hurt and destruction that would involve everyone from doctors to patients and the poorest from the richest of the rich. It's not because AI knows who is white, black, or Latino, but because it learns from examples. If it's trained mostly on light-skinned images, it may struggle to detect skin conditions in darker-skinned patients. Or if most data comes from white middle-aged men, it may miss patterns in women, the elderly, or ethnic minorities. These training biases have been proven in serious studies and can lead to diagnostic errors or risk underestimation in the very groups that already face barriers to healthcare access. Another critical issue is explainability. Some AIs work like black boxes. They get it right but can't explain how. And when we're talking about your health or deciding whether to begin treatment, trusting a system that can't explain itself can be a real risk. Then, there's the question of privacy. These systems require large amounts of sensitive information to work properly. So, who controls that data? How is it protected? In the US, laws like HIPAA aim to safeguard this information, but the ethical and legal debate is far from over. And finally, there's a bigger question. If AI makes a mistake, who's responsible? The doctor? The hospital? The developer? These are questions that neither the technology nor the healthcare system has fully answered. With all these advances, a common question comes up. Will AI replace doctors? The truth is, it won't. but it's already changing what it means to be a doctor. Today, tools like Path AI and clinical support systems are used as co-pilots, highlighting suspicious areas, organizing data, and reducing decision time. They don't replace clinical judgment, they simply expand what's possible. AI handles repetitive tasks. The doctors focus on what only a human can do: to listen, to interpret, to feel. The future of medicine won't be less human, it will be more intelligent and more collaborative. We're just getting started. The medicine of the future will be personalized, predictive, and preventive. AI will use your genetic data, habits, test results, and history to predict diseases and create custom health plans just for you. Multimodal models will combine images, clinical texts, vital signs, and medical records in real time, like a second brain assisting doctors, sensors in your body, and your phone will monitor your health 24/7, alerting you and your doctor even before symptoms appear. And all of this will be possible with systems that are more ethical, more transparent, and more accessible to everyone. Medicine is changing, and there's no going back. Artificial intelligence is transforming medicine right before our eyes. It's not here to replace doctors, but to enhance the very best of clinical care: precision, prevention, and personal attention. But the real challenge is still human. How can we make sure this revolution stays safe, ethical, and accessible to all? If you believe the future of medicine should be built with knowledge, responsibility, and innovation, then this is your place. Subscribe to Curiousverse, share this video, and tell us in the comments. Would you trust a diagnosis made by artificial intelligence? Or do you still prefer a human doctor's voice first? The conversation is just beginning, and the future is getting closer every day.